Hello everyone, welcome to Jessie's MedBio. In today's section, we are going to discuss about our second topic from the third chapter, that is essential newborn care. It is a very important topic for the examination. So, for the essential care of newborn baby, first one is the immediate care of newborn at the birth, and one more is there, that is later and routine care of baby after the birth. So first we are going to discuss about the immediate care of newborn at birth. So immediate care of the newborn refers to the essential care provided immediately after the birth in the labor room to help the baby to adapt to extrauterine life and to prevent complications and also to promote the normal growth and development. So immediate care means it is the essential care which we are giving to the newborn baby immediately after the birth of the baby. And by giving this care, we are helping the baby to adapt to the outer environment, and also we can able to identify the conditions, and thus we can able to prevent the complications, and also we can able to promote normal growth and development to the baby. So under the immediate care or the essential care, around 10 steps are there. So first one is deliver the baby on a warm, clean, dry towel. So it is our first care which is provided to the baby, that is we have to deliver the baby on a warm and clean towel. That is, receive the baby on a warm, clean and dry towel, and we have to dry the baby immediately after the birth, so we can able to prevent the heat loss. Then if there is any wet towels is there, we have to remove it immediately and we have to replace them with the dry ones. Then what is the purpose of delivering the baby on a warm and dry towel means, thus we can able to prevent the hypothermia and also we can able to prevent the infection. Then second one is establish and maintain a patent airway. This is very important. We have to maintain a proper airway of the child. So most of the babies will cry immediately after the birth itself. So first we have to clear the mouth and then the nose using a bulb syringe or a mucus trap. Then if the baby is not crying immediately after the birth means, at that time we have to give an tactile stimulation. Tactile stimulation means we have to give a gentle touch to the baby. So by this touch the baby will get stimulated and start to cry. And after giving the tactile stimulation also the baby is not crying means, or if still the baby is not breathing means, we have to start the neonatal resuscitation, that is the CPR. Then what all are the precautions we have to take during the suctioning means, we have to suction gently. Then excessive suction may leads to bradycardia, laryngospasm, cardiac arrhythmias. So we have to make sure that we are doing the suctioning properly. That is about the establish and maintain a patent airway. The next one is, so the third one is the ensure warmth. We have to prevent the heat loss. For that we have to keep the delivery room temperature to 25 to 28 degrees Celsius, and we have to dry the baby immediately, and we have to wrap the baby in a warm cloth or in a blanket, and if needed we have to place the baby under the radiant warmer, or we have to give the baby to the mother to start the kangaroo mother care, which means to provide the skin to skin contact to the baby and skin to skin contact between the mother and the baby. And we have to cover the baby's head with a cap, thus we can able to prevent the hypothermia. Then fourth one is the assessment and documentation. Assessment and documentation means mainly here they are focusing on the UPGAR score. In previous class I already explained about the UPGAR score. We have to perform the assessment at 1 minute and the 5 minutes. What all are the assessment which is coming under this means, that is the UPGAR score, head to toe examination, birth weight, and we have to assess if any type of congenital anomalies is present or not, then vital signs, and at last we have to document all the findings properly. Then next one is care of eyes. We have to clean each the eye separately by using the cotton swabs which is dipped in the sterile water. While cleaning the eyes, we have to clean from the inner canthus of the eye towards the outer canthus. And also we have to use separate swabs for each of the eye. And if needed, we have to instill the antibiotic eye drops or ointments. What all are the purpose means? By cleaning the eye, we can able to prevent the ophthalmia neonatorum, that is the type of infection which is happening to the eye, and a purulent discharge will be there. And also we can able to prevent the bacterial eye infections. Then next one is care of umbilical cord. Care of umbilical cord means we have to wait until the cord pulsation gets stops. After that, we have to clamp the cord with the two clamps, and we have to cut between the clamps, and we have to leave a 5 centimeter away from the cord stump, and we should keep the stump area clean and dry. We should not dress the area, and we have to observe for bleeding, redness, swelling or discharge. That is about care of umbilical cord. Then care of skin means we have to gently wipe out the blood, mucus and the secretions which is present all over the body of the baby, and we should not rub or remove the vernix caseosa because it will protect the skin of the baby, and also it will maintain the temperature level. And we have to clean the skin folds carefully and properly, that is the neck area, axilla, groin and joint creases. And we have to delay the bathing for 48 to 72 hours. Thus we can able to prevent the hypothermia. And also we can able to maintain the protection of skin. Then coming to the administration of vitamin K. It is very necessary to administer the vitamin K to the baby after the birth. So we are giving the vitamin K injection intramuscularly. The dosage means if the baby is a term baby, we can give 1 mg IM. But if the baby is a preterm baby, we can able to give only 0.5 mg IM. And thus we can able to prevent the vitamin K deficiency, bleeding and also some kind of hemorrhagic diseases which is present in the newborn baby. That is about administration of vitamin K. Then coming to identification of baby. Identifying the baby is very important. So we have to apply an identification band. The identification band should contain the mother's name, the registration number and the date and time of the birth and the sex of the baby. For the additional identification, we can take the footprint, and also the mother should confirm the baby's sex. Thus we can able to prevent the mistakes about the identity. The last one is the transfer of baby. After all these procedure, we have to transfer the baby. If the baby is okay and if the baby is not having any type of illnesses, means we have to make the baby to stay with the mother. That is rooming in. Healthy babies can stay with the mother. What all are the benefits means? It will increases the bonding between the mother and baby, and also breastfeeding will be encouraged, infection will be reduced, and it will increases the confidence level in the mother. And if the baby is not well, means we have to transfer the baby to NICU. There are 2 levels are there, that is level 2 nursery and level 3 nursery. For the babies with gestational age is between 30 to 36 weeks, or the birth weight is between 1.5 to 2 kg, and also if the baby is having any type of congenital malformation, or if there is meconium aspiration is there, at that time we have to transfer the baby to level 2 nursery. Then for level 3 nursery, for the babies with the birth weight is below 1.5 kg, if the gestational age is below 32 weeks, and if the baby is having respiratory distress, convulsions or central cyanosis, which means cyanosis is present all over the body. Then if severe neonatal jaundice is present or the baby is needed any type of major surgery. For these type of babies, we have to transfer them to the level 3 nursery. That is about the transfer of baby. So that is about immediate care or essential care which is given to the baby. The next one is later and routine care of newborn. That is, after transferring the postnatal ward, what all are the routine care we should given to the baby? So the first one is rooming in, which means we have to keep the baby beside the mother all the time. Thus we can able to initiate early breastfeeding, and it will increases the bonding between the mother and baby, and it will helps to reduces the anxiety level, and also it will promote the exclusive breastfeeding. Then second one is we have to initiate the feeding, which means we should advise the mother to start the breastfeeding within 30 minutes or within 1 hour after the birth. Firstly, we have to give the colostrum, which is the first milk which is produced on the mother's breast, that we have to given to the baby. Then we have to feed on demand, which means whenever the baby is feeling hungry, at that time we should feed the baby. We should not force the baby to drink the breast milk. Then what all are the benefits of colostrum means it is very rich in antibodies, and also it will provide an passive immunity to the baby. It is very highly nutritious, and also it will helps to pass the meconium. Then third one is observation for early signs of disease. So we have to report immediately if the baby has failure to pass the meconium within 24 hours, or failure to pass the urine within 48 hours, or if any bleeding is present, or the baby is refusing to feed, or excessive cry or lethargy is present, or jaundice is present within first 24 hours, or hypothermia or hyperthermia is present, then we have to assess for the seizure or persistent vomiting, diarrhea, or any difficulty in breathing, oral thrush, conjunctivitis, umbilical cord infection, and also the skin pustules. And after that we have to record the daily weight, and along with that we have to monitor all the vital signs properly. Then fourth one is prevention of infections. How we can prevent the infection means we have to wash the hands before handling the baby, and also we have to follow strict aseptic technique, and mother and baby should be clean all the time, and we can restrict the visitors, thus we can able to prevent the spread of infection. And if the health workers having any type of infection, they should not handle the newborn babies, and also we can use the sterilized equipments. Then coming to the care of bladder and bowel, which means the baby should pass the urine within 48 hours, and also for the first week the urine output should be 200 to 300 ml per day, and per day the baby should urinate about 15 to 20 times. And if the baby's diaper is wet, we have to change it immediately. And for coming to the bowel, the baby should pass the meconium within 24 hours, and we have to clean the diaper area with mild soap and water. Then coming to the maintenance of personal hygiene. So that is about bathing. So we have to sponge bath daily for the babies, and or alternative days during the winter time. And we can use lukewarm water or mild baby soap, and we have to prevent the chilling. For that we have to dry the baby properly after the bath, and we should not remove the vernix caseosa. And for the cord care, we have to keep the cord clean and dry, and we have to clean it with an antiseptic solution which is prescribed by the doctor. And the cord will fall off by 10 to 14 days. And for the eye care, we have to clean daily with sterile swabs, and we have to wipe from the inner canthus to the outer canthus. Then coming to the parental teaching and follow-up, which means we have to teach the parents about the exclusive breastfeeding, then about the correct holding of the baby and the proper positioning during the breastfeeding, and about the bathing, eye care, coat care, diaper care, then about the vaccination, nutrition, hygiene, then how to prevent the infection, and also about the follow-up visits. So recognition of danger signs requiring immediate medical attention. That is about the parental teaching and follow-up. That is the health education which we are giving to the parents. That is about the essential care of the newborn baby.